Dr. Forte, thanks very much indeed for joining us on the SABC News channel. The WHO has issued a statement of concern about controlled medicines being available to patients that need them during the COVID-19 pandemic. What has raised these concerns?
So, controlled medicines are medicines that, when misused or overprescribed, damage health and may cause deaths by overdose, for example, for opioids such as morphine and fentanyl. Because these medicines, when misused, can be dangerous, they have been placed under international control, meaning that their supply within and between countries and their use in patients is strictly regulated. However, controlled medicines can also be life-saving, and some are in the WHO essential medicines list, as they are needed for life-saving surgery, pain management, intubation and care of patients in intensive care, and for opioid substitution therapy. Some of them are used in severely affected COVID-19 patients, especially those being treated in intensive care units for anesthesia and the management of pain, for example, morphine. In normal times, before COVID-19, access to these controlled medicines, especially pain medicines such as morphine, was already poor. About 80% of countries, in particular low-income countries, had low or no access to these medications. So COVID-19 has created an increased demand for all kinds of medicines, including controlled medicines, causing disruptions of supply chain and causing shortages. This has life-threatening consequences for COVID-19 patients and also for patients with other conditions, which often require long-term treatment, such as diabetes, hypertension, and cancer.
There's this disparity then between countries that are resourced and countries that aren't. How do we balance or help those countries that are perhaps less resourced? You're seeing richer countries able to manage during this pandemic and the poorer countries getting left behind.
Yes, so WHO and other international agencies, including civil society organizations, are advocating against export bans and stockpiling of existing medicines, which has been a case in a number of countries. In order to ensure access to their population, they have established bans in export of those medicines and stockpiling of these medicines for COVID-19, and those countries are particularly producing countries. So through the Access to COVID-19 Technology Accelerator Initiative, Act A, equitable allocation models for new COVID-19 medicines are being developed and discussed among countries, international agencies, and funders. For example, a vaccine facility called COVAX is a global initiative that has been set up to secure sufficient vaccines when we have vaccines proven to be safe and effective for COVID-19, and enable equitable access for participating countries. In the case of controlled medicines, most of them are available from multiple suppliers as generic medicines and thus can be procured at affordable prices. However, overly stringent regulations applied to their import and export by some countries in order to prevent their misuse can be a barrier to their availability. And if these regulations are made more flexible during the pandemic, countries lacking these medicines may have better access.
There is, of course, the issue of fake medicines. When there are shortages, fake medicines can make their way through the system. Is that another concern that the WHO has?
Yes, the proliferation of substandard and falsified medicines, as we call them in WHO, is a major concern for the organization. And this needs to be vigorously tackled. As such, medicines constitute a serious public health risk, particularly to the most vulnerable people. Whenever demand exceeds supply, like in the case of the COVID pandemic, there is a risk of substandard and falsified medicines entering the market in countries. There have been seizures of a wide variety of substandard and falsified COVID-19 medicines, including control medicines such as anesthetics, anxiolytics, and medicines for pain. WHO has instituted a global reporting process for substandard and falsified medicines and shares this data with national medicines regulatory authorities. Global public health alerts are also issued, for example, in the case of falsified hydroxychloroquine in countries, including in Africa. For example, in South Africa, any suspected substandard and falsified medicines can be reported to the South African Health Product Regulatory Authority, SAPRA.
Are there any countries, perhaps in Africa, that you see as more vulnerable, most vulnerable, and that need urgent assistance?
The issue related to the COVID-19 pandemic, and which is affecting particularly control medicine, is affecting all countries. As we described before, the fact that there are shortages of medicine, this is due to a number of problems that are pertaining to COVID-19. For example, I would mention the lockdown and the restriction of movement within and from countries producing active pharmaceutical ingredients, but also finished product, are affecting all countries in the world. For example, the restriction in India, the main exporting country for medicines, especially generics, have caused severe tensions in the medicine supply chain at global level and also in Africa. For example, India's production capacity has dropped 40% below what is in normal times. And the production capacity in countries like South Africa, for example, which is an important producer, has also fallen due to higher demand caused by COVID-19 pandemic. So basically, all countries are affected because the supply of medicine is also dependent on countries like India and China, and all countries in the world are affected. And unfortunately, particularly countries with vulnerable supply chain systems and with low or no production capacities are mostly affected.
Dr. Ford, in terms of solutions to some of these barriers that we've talked about, what can be offered as solutions? What can be done?
There are a number of solutions. For example, diversifying procurement sources of medicines, promoting the strengthening of their local production capacity, and ensuring maintenance of buffer stocks of medicines in order to become more independent from production and supply, for example, from Asia and Europe. International organizations such as WHO are also working very closely with countries, including the African region, to facilitate countries' procurement of quality assurance medicines from international logistics platform, but also from pool procurement. There's a lot of work also which is being done in order to promote information sharing among countries on pre-qualified suppliers that can guarantee quality assured medicines. And also there is a lot of sharing of experiences and information in terms of the pricing of those medicines, which in the case of COVID-19 can also increase because of the shortages that we are facing at the moment. So a number of concrete interventions that can be taken and that are taken by countries, including in Africa, to reduce the disruption of the supply chain, reduce shortages, but also promote international collaboration to make sure that all medicines that are needed during this pandemic of COVID-19, including control medicines, which are in need for people suffering from pain, are implemented in countries.